This is Kimberly Cerrone, CEO of Tiatros, and Seth Norman, COO of Tiatros. And they are a mental health social support platform. It combines a whole bunch of stuff, as you'll see, clinical expertise, peer communities, and technology, all about advancing the mental health, right? And getting to sort of behavioral change and resilience. Now, before the pandemic, Tiatros has done a lot of work with another group of a group of soldiers, or many soldiers and servicemen who were suffering from PTSD. And basically they've entered this challenge because they want to take these tools to another group of extremely stressed professionals, obviously the frontline people working in hospitals and health systems. So right now, they're going to show you how they do that.
We created Tiatros to heal combat veterans whose mental health deteriorated because of the extraordinary demands being placed upon them. They urgently needed ongoing emotional support and effective psychological care. Seth is going to demo our solution to show you how Tiatros can help overworked and emotionally distressed frontline healthcare workers who are fighting their own war.
All right, so without further ado, this is what it would be like for a frontline healthcare professional to use Tiatros' HIPAA-compliant platform to log in from any internet-enabled device from either their place of work or at home, and whenever their busy schedule allows them to. And what makes Tiatros really special and what allows us to really engage our users is our focus on not just developing individual mental health and well-being skills, but on the transformation of organizational cultures. So on Tiatros, participants work alongside their fellow healthcare workers, getting to know one another while sharing the burden of their responsibilities and strengthening the bonds of community. And just like veterans of Iraq and Afghanistan who we helped through the process of post-traumatic growth, this is a population that responds very well to a sense of responsibility for helping other people, and Tiatros lets them shift the focus away from personal stigma and towards a sense of shared purpose. Now, also unique to Tiatros is our balance of synchronous and asynchronous participation, which allows time-constrained care providers to maintain this peer group cohesion, all while working through our programming at their own pace. And so what that means is each week, they're going to enjoy a new set of expert-led, high-value content that teaches the principles of cognitive behavioral therapy. Now, this work will include watching psychoeducation lectures presented by healthcare professionals who can both speak to the psychological condition of burnout as clinical experts, as well as the personal experience of burnout as fellow healers. They'll also go through and work on a battery of evidence-based journaling and written exercise prompts, which will help these folks begin to understand and share with each other their own personal experiences of burnout. And meanwhile, all of this work is done while tracking and managing not only the clinical measures of burnout and stress, depression, anxiety, and so forth, but also the personal emotional growth that comes from doing the work together. Most importantly is that while all of this is being done on an individual schedule, the participant is constantly encouraged to both give and receive feedback to the rest of the peer group. Ultimately, burnout is a condition driven by the sufferer's sense of disconnection from the meaning and mission of their greater organization, by a sense that they lack the resources necessary to affect positive change. But what makes the Tiatros experience unique is our patented process for bringing different people together and giving them the tools and resources they need to transform not only their own lives, but their entire workforce. And long after a peer groups program is completed, frontline healthcare workers are able to stay on our platform, continuing to communicate with each other, as well as with other peer groups that have graduated from our burnout program, and use our communication tools and exercises to continue cultivating real-world cultures of well-being as they choose to define that word. It's ultimately by giving healthcare professionals the skills they need to heal themselves, as well as the tools they need to collaborate and support each other, that Tiatros becomes not only a highly engaging and effective means of overcoming the burnout crisis, but it becomes a highly scalable and affordable solution for healthcare systems.
Thank you, Seth. 100% of veterans improve their mental and physical health on Tiatros, with most moving from the moderate to severe clinical range into the normal range of mental health. Up to 95% complete their Tiatros program and show empirical proof that their ability to cope successfully with work and life-related stress dramatically improves. We've published peer-reviewed scientific reports that show behavioral attributes associated with mental well-being, improved physical health, increased productivity, and effective teamwork dramatically increase. We can do the same for frontline healthcare workers, getting them the emotional support and psychological care they urgently need. Thank you.